So let's kick off for today. Good afternoon, everyone. Welcome to Unpacking the Complexity of Increasing RRR Homelessness. My name is Brendan Delahunty. I'm from Mallee Family Care Community Legal in Broken Hill. We'd like to begin today by acknowledging that we're meeting on Biripi country and paying my respects to Biripi elders, past, present and emerging. Welcome to today's session. We have four speakers for this session from Shelter New South Wales: Thomas Shallow, Homeless Persons Legal Service and the Justice Equity Centre, formerly PEOC, Kira Levin, and from the Coffs Harbour Office of Legal Aid New South Wales, Kylie Hyde and Melanie Bradfield. So to set the scene for today's discussion, we'll begin with brief presentations from each of the speakers, and this will be followed by a panel discussion. And at that point, we'll be joined by Eloise Parab, Acting Policy and Advocacy Manager for Tenants Union in New South Wales. Eloise is joining us online. And following that discussion, we'll invite questions from the floor. So without any further ado, I'll begin. I'd like to invite Thomas Shell to the microphone. Thomas is Senior Policy Officer for Shelter New South Wales. He's agreed to provide an overview of housing policy issues affecting RRR areas. Thank you.
All right. Hi, everyone. My name is Thomas. I lead the policy work of Shelter New South Wales. We are the statewide peak body for housing policy. We represent the interests of people living on lower income. So traditionally, that was the first two quintile of income earners. As the cost of living crisis, or rather I should say system, progresses, that includes more and more moderate income household earner as well. We are especially concerned with housing insecurity, housing and affordability, homelessness, and our vision is for a secure home for all. So excuse me, AV Desk, I can't see my notes. If you could please switch to presenter mode. I can speak without notes as well, it's fine. So our objectives, it wasn't my idea. They often get called the AAA. I don't really like the metaphor because in a system that suffers from increasingly financialization of housing, I don't really think that a credit metaphor is a really good one. So here we go. I've said that. Nonetheless, it really allows you to remember easily. We look at affordability, accessibility, amenity. Affordability, I don't need to expand on too much. Rental affordability is particularly bad. Purchasing price affordability is also extremely bad, basically along the entire coast. In areas where you have decent affordability, you don't have jobs or decent incomes quite often, or you have housing that is really low quality, or you still have land that's affordable, but you can't build housing affordability on it. Accessibility, we often think about physical accessibility of buildings. In particular, I'd like to note that New South Wales is the only jurisdiction with WA that is still dragging its feet on integrating the National Construction Code updates from 2022 into its state building legislation. Those were the silver level of livable housing guidelines updates that allowed access to the dwelling in a sense. So step-free entrances and things like that. And then things like reinforcing the walls to allow for future retrofitting. So it's not even a high standard. It's just better design. And finally, amenity. So providing housing that has high amenities, so that housing that's well located, with access to transport and services, housing that has good thermal performance, good energy efficiency, and all of those things. We produce, in partnership with SGS Economics and Planning, a rental affordability index every year. I encourage you to go and have a look at it. It's a really easy to use tool that provides a single score or measure of rental affordability in the entire country. So not just New South Wales, that's with our federal partners, National Shelter. It gives you a score. It divides the median income of a certain type of household by a qualifying income, the qualifying income being the income that you need to only spend 30% of your income on housing costs for the dwelling that you need. So you can actually go on the website, look at, say, double income with kids, a pensioner couple, no kids, and it will give you a single measure. Affordability has severely deteriorated in the entire country. So if you do not have a double income, it has become very difficult to rent, as everyone would know. So that's the context. I'd like to make a really simple, basic point that we forget about all the time, which is homelessness is a housing problem. The answer is in the name, really. It's homelessness, but often in public discourse, we just lose that sight. There's a lot of conversations around individual risk factors that cause people to become homeless, such as substance use and abuse, mental health issues, psychosocial disability, trauma. All of those things are true, but I think they tend to be true for people who experience chronic, repeated street homelessness and rough sleeping. Then perhaps, yes, it's more about the individual vulnerability. But if you look at homelessness more broadly, including overcrowding, and then if you add housing insecurity or simply a level of housing stress that prevents people from affording the other necessities in their lives, like medication or taking care of their pets or things like that, then it's really not about individual risk factors. It's about structural housing conditions and housing market conditions, in particular availability of rental housing. If you look at Corbin and Alden 2022, they've actually shown it's based on US data, but that there tends to be lower rates of homelessness in places that have higher rates of poverty, which is very counterintuitive, but it's because in those places that have high rates of poverty, you actually have some housing that is still affordable to people on the lowest income, even though it might be housing of low quality and housing situations that are not desirable. I've added a qualifier as well, which is, from our perspective, homelessness is a social housing problem. You know, we have this discourse in the media and in politics that it's a supply problem. We've had years of record supply, and it has done very little or close to nothing really to address housing affordability issues. And one argument in particular that comes back all the time that frustrates me a lot is property developers pretending that they're going, you just need to let them build enough houses for prices to fall. So they pretend that they're going to get up in the morning and work so hard so they can lose money, which is ludicrous, frankly. And my apologies if I go a little bit off script because I still don't have my notes, but I can always complain about property developers. That's fine. All right, structural factors. So rent increases, median weekly rents have been increasing rapidly. I think everyone in New South Wales would have noticed, more or less. Other structural factors, top of my head, you have, of course, population growth. I think it's important to recognize that. We can be a little bit shy sometimes as progressive peak bodies to talk about migration. It's a pretty simple demand factor. It's also really easy to misframe it as the main issue driving demand, but obviously it's a factor that does contribute. And I'm sure that if we stop migration tomorrow, house prices would fall, but we would then have much, much, much bigger problems than house prices. Productivity per capita has not increased in Australia for the last 20 years. The reason why we are still, in so many ways, the lucky country is from population growth and digging things out of the ground. So I don't think that's a desirable solution. Of course, the other demand factor has to do with the tax treatment of housing. So demand for housing is virtually unlimited because once you already have one house, you can then borrow against the equity to buy a second house. And then if you have a high income as well, you basically cannot lose because you can either negative gear, which is you deduct the losses from your taxable income, you wait for the property to become positively geared, and then you do a big capital gain, which is only taxed at 50% of your marginal tax rate. Whereas if you drive an Uber on Sunday, that's 100% of your marginal tax rate. Or you positively gear it and make money straight away. And so you will always beat the first home buyers basically at the auction. So that means that the demand is virtually unlimited, in particular in times where interest rates are low, which is not currently the case, but they are expected to lower. The market has already priced in a 25 basis point cut from the RBA, I believe. And so house prices are expected to increase. And then, of course, you have supply factors. I've already mentioned developers control supply, etc. I'll go a little bit faster. On the other side of that, social housing in Australia is becoming increasingly residualized. That's creating all sorts of issues. One of them being that you actually concentrate disadvantage, in particular in some areas such as social housing estates, like high-rise estates. If you put a lot of people with, mental health issues or substance use issues or any other sorts of high and complex needs, you then create antisocial behaviors and social issues and all these sort of things. I think it's very problematic that this has then become a reason to sell off the social housing, like the old Communities Plus model, sell off social housing to the private market, saying, "Are we going to create social mix?" In a sense, I also wanted to touch on affordable housing. So affordable housing has become very trendy. We talk a lot about affordable housing. I At Shelter New South Wales, we like that, and at the same time, we don't. So what we like is that we are now talking again about non-market housing, government intervention housing that is actually targeted at people who do have a full-time job, like people like police or nurses and things like that. At the same time, it's a bit of a problematic discourse, in particular when you see local council, they go to quite a length in strategic planning documents to explain, are we going to deliver affordable housing and manage it? But don't worry, it's not social housing. It's not for actual poor people in your neighborhood. It's for nurses and police. You don't need to be worried. I think that sort of in between the lines discourse is very problematic. At the same time, what's very encouraging is that we see that all levels of government are becoming increasingly willing to go back to post-Second World War sort of model, in which government is actually providing housing to a wide range of people from all sectors of society for whom the market is not providing. And that then allows you to cross-subsidize the portfolio, so you can cover costs from the income from some tenants, and that allows you to provide a deeper subsidy to others. So we would certainly support the provision of more social housing first and foremost, and then also for affordable housing. But I think we need to be careful when we advocate for systemic change in the housing system, that it doesn't become affordable housing instead of social housing. There was a recent article in The Guardian that showed the issues from affordable housing being defined under the ministerial guidelines as a discount to market rent. There was this affordable housing property in Bondi Junction that was going for $1,100. It must have been a week. I think it was a 2-bedroom in Bondi Junction. That is obviously not affordable. And then you have the same issues of tying your affordable housing stock, which is supposed to provide an alternative to the market, but you actually tie it to the market. So our position at Shelter is that affordable housing should be, the rent should be set on the income of occupants, and there should be a mix of occupants from Q1, Q2, Q3 income earners. And it should also be in perpetuity. It shouldn't be provided for 15 years. The issues in our housing system have been in the making for decades. It is so painfully obvious that a 20% discount to market rent for 15 years does nothing to solve the issue. It might make a little difference to the person who accesses it. It's obviously not a systemic solution. I'll skip on that one quickly. We all know that. Social housing falling short of need and population growth. A quick comment on the measures from the New South Wales state budget. Going back to what I was saying about general supply and general measures, they have a stated aim to increase affordability, but there's actually zero measures to control the actual outcomes from that supply. The pre-sale property guarantee is to guarantee that developers will be able to bring supply online quicker by maybe allowing them to access lower cost finance, by providing a guarantee for what they can't sell off the plan. There are a number of issues with that. There's no measures to control the rent of those properties, who will buy them, who they'll be rented to. It's just such bad public policy to have zero control over public policy outcomes. And I think quite often it doesn't matter which level of government you look at. We ask very little of organizations and of people with high wealth and high income who get given all those tax concessions. Whereas if you contrast that with people in the social security system, we ask them so much to just get a tiny, tiny bit of money. Also build to rent. So one of the measures in the budget was a 50% land tax concession indefinitely for build to rent property providers. I I don't mean this as an insult being one myself, but build to rent is for yuppies. Like literally, it is for high income young urban professionals. It's a premium product. You might get a longer term lease. You might get good services. Maybe, I don't know, some place to do yoga in the basement. It might be nice as a rental property, and it does provide an alternative to amateur landlords. We all know the issues of amateur landlords. It might be good to grow the professional side of the sector. It is not a housing affordability measure. So we also have our doubts about the build to rent tax concessions. And quickly on that, happy to discuss with the panel, but we want more social housing, up to 10% of the total stock, which would restore the safety net, invest in repairs, maintenance, upgrades of existing social housing stock. The public landlord should and can be the best landlord in New South Wales from our perspective. Funding to SHS, good growth with affordable housing attribution schemes. In rural and regional areas, I think there are affordability issues. There are also availability issues. Sometimes you may be able to afford the housing, but it's just not there. There's not enough stock, or there's no stock that's adapted to your needs. Either you can only get a 3-bedroom or you can't get the 4 bedrooms that you need. And on the question of whether policymaking is too city-centric, I think there's an issue with distribution of half funding. Half funding has disproportionately gone to Sydney, even when you correct for population. There is now a mention in the guidelines of funding being on a per need basis, but it remains really inequitably distributed. So we're thinking that there needs to be clear criteria for the allocation of that funding, making sure that the regions get their fair share. Having said that, also recognize that I've traveled around the state and I speak to providers across New South Wales, and everyone says we haven't got our fair share of the half funding. And I think everyone believes that generally, but the problem is that half is it's barely making a dent compared to the scale of the need. So everyone feels like they didn't get enough. Through our federal body, National Shelter, we advocate for quadrupling the capital investment in the half. So having a 2 billion per year recurrent investment. And finally, access to support services can be complicated in regional areas. And I'm not going backwards. We'll talk about that on the panel. I think I'll leave it here shortly. We need to monitor the tenancy legislation reform. I will encourage CLCs to do more political engagement and advocacy work, meet with your local MPs, share your support for housing and homelessness system reforms, join the campaigns of the sector. I think sometimes as a sector that provides legal assistance services, people can shy away from politics, and I know it can be very tricky with funding constraints and things like that. But I believe we can all work together towards a secure home for all. And I will get in trouble with management if I didn't encourage you to become a member. Thank you very much for your time. I do not have hi. I'll just clarify what I mean by build to rent. So build to rent is a private landlord, a private professional landlord. I believe you mean a community housing provider. Build to rent buildings are not subsidized. Yeah, we can have a chat about who it is. So by build to rent, I meant providers like Mirvac, who would develop an entire building and then rent it, often at a premium, so like very high rents. And they want to have, yeah, we the big body for the community housing sector, especially homelessness services. I certainly would never criticize the community housing providers sector. I think we have a misunderstanding on what's build to rent. Yeah, I'm happy to have a chat. So just to clarify, build to rent are large scale property developments that would then be rented to people on long-term leases. They tend to be expensive premium products because they're not sold off to individual investors that then decide to live in the building. Okay, we can have a chat. It's its sort of own class of assets as compared to community housing providers who are also building to rent. Just to be clear, when we talk about build to rent as a product, it's a purely private sector product. It's not subsidized. There are no eligibility criteria. There is no control over who rents there. It's not targeted at anyone in particular, the build to rent sector. That sounds like a community housing provider.
Can we?
I guess there is an issue with capital build to rent, if you like, which is a specific product. And yeah, indeed, community housing is being built to be rented. I think it's just a definition thing. I'll come and have a chat with you. Of course.
No, I think that's a useful point to make. Look, we need to move on. Just at this point of the discussion, we'll hold further questions just until we hear from the other speakers. Our next speaker is Kira Levin, Principal Solicitor for the Homeless Persons Legal Service, to talk to us about the service, about developing relationships and referrals with RRR partner services, and how RRR advocates can tap into some of those initiatives.
Thanks, everyone. Everyone's very spread out and I feel very high up, but I just wanted to start by acknowledging, I think I've got some slides. Yeah, they're coming. Okay. Oh, I have to change it? No? Okay. I just want to start by acknowledging and paying respects to the Biripi people, the traditional owners of the land that we're meeting today, and pay respects to their continuing connection to the land, water and community here. I work on Gadigal land, so I also pay respects to that country as well, and to all of our Aboriginal and Torres Strait Islander colleagues that are here today. So I am going to talk about HPLS today. So as Brendan said, HPLS is part of the Justice and Equity Centre. We're based in Sydney, and we do a range of things at the Justice and Equity Centre, including the Homeless Persons Legal Service. So we are a community legal centre. We focus on civil rights, which includes police practices and the treatment of asylum seekers and youth detention, disability rights, energy and water, and First Nations justice and homelessness. So our Homeless Persons Legal Service is essentially just a front-facing legal service where we provide individuals with legal support and representation, advice, to people who are homeless in primary, secondary or tertiary homelessness, or at risk of homelessness by reason of their age or financial hardship, family violence, or other legal issues that make it difficult for them to access and maintain secure accommodation. The way that we deliver the service is that we work with pro bono a lot. So we're a small team of 10 people and a multidisciplinary team. And we do a lot of the outreach ourselves mainly in the city of Sydney. And then we leverage the support of pro bonos to help us deliver the service. We also work really closely and collaboratively with partners. I'm just going to move this along. My slide here is very city-centric, as you can see. Photo of Sydney. This is just an overview of what I'm going to talk about today. So about HPLS, street care, what impact we want to see, and the issues and solutions, or some of the issues and solutions as I see them. But I'm actually really, really excited to be here because I really want to hear from you who work in the regions. And I think this has been a really awesome opportunity to talk to people across New South Wales and hear about the specific issues that are impacting on your communities, because in particular, the issue of homelessness, I think, impacts communities really differently, obviously from between Sydney and other regional and rural communities. So yeah, the Homeless Persons Legal Service, we do a lot of outreach, as I said, mainly in the city of Sydney. We work collaboratively with partners and we try to work at the pace of our clients and in a trauma-informed way. And this is a photo of some of our team, some of whom, some of our secondees have moved on. So I guess the first thing to say is that homeless persons legal service is obviously not just a service for people who are sleeping on the street or rough sleeping or have been chronically rough sleeping, but also people who are living in their cars or in social housing but are at risk of losing their housing. And we provide advice and representation in court and in NCAT, and we mainly focus on housing issues, so eviction, repairs, issues with Homes New South Wales and other community housing providers, money problems, violence, criminal matters, and we have a specialist support service for women. So back just after or during COVID, we kind of did a big reflection on our service and realised that because of where we were delivering services, we were seeing the majority of our clients were men who were rough sleeping, and we were really missing that really important cohort of women and their children because of where we were delivering our services, and because women experience homelessness in a really different way to men. They often don't rough sleep, and it's, yeah, I'm sure you're all aware about the kind of hidden homelessness of women. So we developed a specialist women's service within the homeless persons legal service. And we have a caseworker who works in that service, and we do civil law support. And we also have a dedicated criminal lawyer just for women in that service as well. So I really wanted to talk today also about street care. Street Care is our lived experience advocacy group, which was founded in 2009. So the members of Street Care, there are 10 members of Street Care. They've all got lived experience of homelessness. They meet monthly. And they drive change using public forums, including the media, hosting events, and through direct advocacy and consultation with government. So they advocate overall for safe housing as a human right, and also to reduce the stigma of for those experiencing homelessness or living in social housing. They've been, for example, really vocal in forums including the End Street Sleeping collaboration, and did a lot of work around the COVID response. They also help guide the advocacy work of the homeless persons legal service and provide valuable insights into barriers preventing people from having a safe and secure home, and offering practical solutions for empowering people living in social housing or on the street. You'll see in these photos, the first photo on the left is one of our Street Care members, Rachel, at a Homelessness New South Wales event, with being interviewed by the media, and then Anna in one of our photos outside Wayside Chapel, which is a homelessness support service in Sydney, displaying her artwork. We had an art event during Homelessness Week last year. And also the photo of a few members of Street Care receiving the New South Wales Parliament Community Recognition Statement, and one of our members, Tony, speaking at another event. So Street Care has focused on a number of important issues, I guess, over the years. Certainly, they've been really interested in the over-policing of people experiencing homelessness, contributing to the investigation of alcohol-free zones in Sydney. They've gained improvements to temporary accommodation policies, which I'll talk a bit more about. They are also very passionate about improving the way that Homes communicates with people who are living in social housing. So I don't know, you probably all read letters that homes have sent to people, a lot of them including threats and scary language around what's going to happen to them if they don't do certain things. Or so they've been really consistently advocating to have these kinds of communications changed, yeah, to allow them, I suppose, to be a bit more trauma informed, as well as the kind of the training of people who are working for CHPs and for homes as kind of client officers. They also were instrumental in developing the protocol for homeless people in public places with DCJ. And I don't know whether many of you know about the protocol, but it's basically a statement of rights about people who are experiencing homelessness, and tries to encourage people who would be interacting with people, particularly people using public space or sleeping on the street, about the way that they should interact with people who are sleeping on the street. And I can certainly guide you to a link to the statement of rights. So I suppose, what is the impact that we want to see at the Homeless Persons Legal Service? So we are a service that, as I said, provides individual services to clients on an individual basis. We also we have a theory of change, and we work within a broader organisation, obviously being the Justice and Equity Centre, that wants to see broader systemic change. And we have some resources to be able to advocate, to respond to government inquiries, to make submissions, to raise things with government, and in particular street care, because of the kind of the long-term work that they've been doing. They've gained a lot of respect from government, and they can often get in the door to I suppose, yeah, to advocate. And certainly my experience has been that their voices are the strongest, the people with lived experience, the ones that are have the most impact. So the things that we are hoping to achieve through the Homeless Persons Legal Service are reduced homelessness, or at least preventing homelessness from happening before, because we know that once somebody becomes homeless, it's really freaking hard, especially right now, to get back into housing. It's so yeah, that sort of prevention work. And also the increased respect for people who are experiencing homelessness. And that's where it comes to kind of policing and, yeah, the policing of people and the targeting of people using public space, and the criminalisation of people using public space. I wanted to touch on a couple of examples of how that sort of journey works. So how something that street care raises, or responds to, then becomes something that we use as a policy mechanism, I suppose. So we recently responded to a public toilets inquiry in August last year. It was an inquiry established by the New South Wales Legislative Council. There were broad terms of reference about the design, accessibility, funding and best practice standards. And we sought input from street care. 3 street care members gave evidence at the hearing. They had an interview with the Law Society Journal in response to it, and they also presented on 2SER, which is a local radio station in Sydney. I've only read the transcript of their evidence that they gave, but it was, from what I understand, and we have our project officer who leads street care in the room today, who was there, and it's just really, it has a lot of impact to hear from people directly about what it's like to be relying on public toilets, what's really important when you are street sleeping, or when you don't have a secure place to go and you're using public amenities a lot, and how that impacts on you. it was something also an issue. I suppose I raise it here too, because I think that there's probably different issues that impact your communities when it comes to public toilets. I have heard on the grapevine before that, you know, councils have locked people out of actually being able to access public toilets because they specifically don't want people experiencing homelessness to use them. And so this is where I kind of, I guess, you know, calling on you to bring your stories and share, and for us to share what the specific issues are in each of our regions can be really useful and powerful. But I'll get to that as well. I'll keep moving. The other thing I just wanted to touch on was TA, temporary accommodation, which I guess is something that does come up a lot for your services as well. And I'll just say that this photo is an image that the Senior Homelessness Project Officer from City of Sydney took just a couple of days ago. She started a project called the Village Voice Project. It's an art installation in Surrey Hills, and it's designed to capture and share diverse local stories and forgotten histories in the form of poetry and prose. And these for the 3 months in June, July, August, Street Care have been displaying their prose. So it says, "The Lucky Country, homelessness seen but unheard. Street Care, we are lived experience advocates, empathisers and change makers. Everyone deserves a place to feel safe and warm at home." And somebody has set up their bed there as well. So just thought it was a very powerful image. But getting back to TA, so an example of where Street Care has done advocacy, they were engaged in ongoing advocacy over a long time about TA, removing the rental diary requirement, which was, as you probably know, a requirement that you go and see a whole lot of properties that you can't afford to buy, can't afford to rent, but you have to put them down on a piece of paper to show that you're making an effort to resolve your housing issue. That was then paused for a year. They also advocated to extend TA from 2 to 3 days to 7 days. And I was in a meeting with a government minister, with a member of Street Care, who was like, "What is 2 days? 2 days is an opportunity for me to have a shower in this place and then like go to sleep. And then I've got to come back to the housing office and renew again. And I have no opportunity to do anything." So from there, they did extend it to 7 days. They've since reduced it again to 5 days. They recently wrote to the minister about the 25% contribution of income that they're seeking for TA. Because they were really concerned about the impact that this was having. It was discouraging some people from accessing TA because of the cost involved. And there's been some small wins along the way with TA, and they certainly know it was Street Care in the beginning that brought attention to this issue to the minister, and following that, the SHSs kind of came on board and said, yes, this is an issue, and had a whole lot of examples of where this had been an issue. And I think also hearing from people with lived experience, I will just say their actual experiences of something like TA, like what kinds of places. I know that in the regions, it's a whole different ballgame where there just isn't any TA in this region. So you're asked to go hundreds of kilometres to access TA. For us, it's just inadequate. It's in motels. There's no kitchen, like paying 25% when you can't cook in the place where you're living. It's not safe for women. You might be trying to recover from dependence on drugs, or it's a very complex thing. So hearing from them firsthand, it's interesting when they're telling their stories and then the minister's like, is a bit speechless, really. How much time have I got? Have I gone over? Okay. I just wanted to quickly say that we also raise issues in our casework, in particular issues around for Aboriginal women, people with poor mental health and people exiting prison. So if these issues, or if you're seeing systemic issues in your work, also to do with the differing policies between CHPs and homes, policies not being accessible, the absence from dwellings timeframes that differ, the lack of procedural fairness. These are all issues that we're really, really interested in and would be really keen to have a conversation with you about. And I will just say the other thing is policing. Very interested in this issue of over-policing of people experiencing homelessness. So how can we resolve this? More engagement, and certainly we have some capacity for street care to have involvement from regional and rural participants. So if you know people who might be interested in being involved in a group like street care, in whatever capacity that is, they don't have to attend monthly meetings, please come and speak to me or to Shah, and all the details are there, and I'm also happy to share them with you. Thanks very much.
Thank you, Kira. So to bring the focus more firmly onto a RRR perspective, I'd like to invite Kylie Hyde and Melanie Bradfield from the Coffs Harbour Legal Aid Office to talk about some of the work they've been doing.
Thank you. Kylie and I can talk, so
yes,
you might have to wave your hand at us or something. And I'm a self-professed housing nerd, so I'll go on about it. Really quickly, our backgrounds. We're both from Legal Aid in Coffs Harbour. I'm the senior solicitor of the civil law team there, but I have a really long history in housing. Started as a tenant advocate, worked at Redfern Legal Centre, housing team at Legal Aid, Coffs Harbour now. So definitely a passion for me. And Kylie is our specialist homelessness solicitor in the Coffs Harbour office. But also has some other wonderful experience.
So my background has largely been in disability related law. So NDIS team at Legal Aid, and then the wonderful Mid-North Coast Community Legal Centre with their disability law service, and back to Legal Aid doing a variety of generalist things. So very fortunate to have kept all those wonderful connections in that space. So, and very happy to be in this role, which intersects, as you are well aware, all of those things come together in the homelessness space.
Yeah. So that's me and Kylie, but generally about Legal Aid as well. Just wanted to give some context because I know Legal Aid's a bit of a monolith. It's a big organisation. We have regional offices all around the state whose focus is very much within their regional community. And 6 of those offices have specialist homelessness solicitors that are funded by Legal Aid. So their role is to provide targeted legal services to individuals who are homeless or at risk of homelessness. There's obviously, we try to avoid duplication of services because obviously the tenancy services do an amazing job, and the Aboriginal tenancy services, HPLS, CLCs, but so we try to avoid that duplication, and we try to provide a complementary service with a real focus on removing barriers to housing for people that are already homeless, which can also include assistance around other civil law issues. So while we do a lot of work in the specific housing law space, we also do a lot of other work in terms of civil law issues that are affecting people who are homeless or at risk of homelessness that has, a link to the reasons that they're homeless. And I guess for us, if I'm speaking for the Coffs Harbour office and for the other regional offices, our focus is really on building relationships with stakeholders, community organisations, CLCs, tenancy services in regional areas, so that we can really be a hub in those areas. So that's the context in terms of Legal Aid. Kylie will talk a little bit about what and who we're seeing.
So look, it really is about relationships, and we hear a lot from the people that we interact with. Unfortunately, a lot of those stories about people falling through the cracks. So it is a bit of a postcard lottery as to where you are, as to the type of services you get, the amount of homes or who your providers are, what kind of information, what kind of services you're going to get. Unfortunately, it shouldn't be that way, but it is. It's a bit of a postcard lottery, particularly in
Regions,
in the
exactly.
regions.
Yeah.
So we do see, the same issues that you see in the city, you're going to see in regional areas, but perhaps intensified. So the main people are, look, lots of people are falling through the cracks, but the main people we're seeing are younger people, particularly people leaving care. This is a huge area of need, and there are so many legal issues around that that need to be addressed. Older women, particularly, as you were saying, homelessness presents very differently. So not so much the rough sleepers, cars and couch surfing. So house sitting for other people, which can lead to their own problems when you've got someone house sitting a social housing tenancy, so as an unauthorised occupant and all those other things that come in. So people living in their cars, and we see a lot of the legal issues surrounding that, the rego, the fines, the move on notices. And a lot of these cars, break down and they can't afford to be fixed, so they will get towed. So they will be...
Let alone go and apply for a private rental.
Yeah. So being able to afford fuel, one of our homeless hub, one of the biggest things they do is try and give fuel vouchers to people so they can move their car from place to place. Now, people living in remote areas, in particular, we've seen some issues with this, with the recent disasters, unfortunately. What we had seen, we'd had a big move on from our jetty area where there'd been a lot of homeless people camping. It was fenced off, people were moved on, and they moved out. So we lost them. So we were all desperately trying to find them because we were getting all these notifications about rising waters in creeks, and we didn't know where they were camping. They've gone into our national parks, they've gone along our waterways, and we can't find them. So for those homeless head counts, good luck. Really, we're trying our best to see who the numbers are, but when we don't know a lot of the time. Sorry. Oh,
And
avocado
Anna from Coffs
yeah.
Harbour is saying they're on the avocado. Yeah.
Yeah, and this is it. Often on farms, often in, that farmers are letting them camp places. So we are losing people. We're seeing people on supported pathways for housing where the supports simply fail, or they've burnt their bridges with one provider and there is nobody else to fill that gap. So they are by themselves, or their worker has left and they don't know how to find somebody else to help them because they keep losing their phone, or they, these connections. The other thing that breaks my heart is people who are eligible for NDIS and DSP, but they've got no support or providers, and there's no one to help them fill in the forms. So that is, our disability advocates, do amazing work. And I know that the CLC does amazing work in that space if we can find these people and if they come to our services. So,
importantly, obviously, as a legal service, we don't generally help with filling in forms and applications and things like that. But I'm sure you all are dealing with the scope creep and all of a sudden I'm doing a bit of social work for my client because I don't know who else to help them, and it's the only way to get to the legal issue to actually assist them. So and I guess that kind of goes to the crux of the biggest, from a service delivery perspective on the ground, that we experience, which is that we're really reliant on our relationships with stakeholders and community organisations to get our clients through the door. So we engage with, there is a really active Coffs Coast Housing Partnership Group, which Kylie attends monthly. And that's the specialist homelessness services, the community housing providers, someone from council, DCJ. In Coffs, it's a really active group, and they sort of, keep tabs, or they're the ones that are out there trying to find where the newest rough sleeping space is. And those are the services that we rely on to refer to us. But I guess the issue is that just as compared to the city, there are less services, less options for services for people. Those services are so stretched. So many of the specialist homelessness services, another issue in the regions is you have people coming from other places. So Queensland, inland Western New South Wales, all coming to, particularly to Coffs Harbour, which is obviously a big hub, probably similar in Port. And the homelessness services aren't able to actually service everybody. So they're restricting their criteria and saying, if you're not from here, we can't help you. And then when they're coming to us, they are, for legal assistance, we can't link them in with anybody. So they're still eligible for our service just because, I mean, I don't know that, I mean, I don't want to misspeak about the homelessness services. They might not be saying, no, we can't help you, but they're having to prioritize. They have to find a way, obviously, to manage the demand. So it's a real problem for them, understandably. And then the flow-on effect for us is that in order to really get to those legal outcomes, we need our clients to have that practical support, which is not always there, despite the best efforts of these services. Like, we're certainly not criticizing them in any way.
No.
And then, you know, other issues around the temporary accommodation issue, massive in the regions. There's just not enough of it at all. And I'll talk about an example in a little bit. People having to go, you know, hundreds of kilometres away from their services, NDIS services, moving back and forth with kids, those kinds of things. And then when it comes to social housing as well, you know, there's a lot of similar issues in terms of the high density complexes. There might not be high rises, but there's complexes or areas where there is a lot of social housing, psychosocial issues that those people have, which inevitably lead to neighbour disputes and antisocial behaviour. And I guess the difficulty, again, with the lack of services is that because it's difficult to link people into services, there's less option to transfer to a different area because you're in a regional area where there's one community housing provider. And it means that the social housing providers feel that their only option is to seek termination, when really the foundational issue is a lack of supports for these people, as opposed to, you know, breaches of their tenancy agreement. So it's a complete reverse housing first approach. So, and I mean, that happens in the city, but I do, you know, based on my experience coming from the city to the regions, it's definitely exemplified in the regions, as opposed to my previous experience.
I suppose a good example would be, we've got Pete's Place in Coffs Harbour, which is the homeless hub. Now, I had a chat to them and we work very closely with them, as I know that CLC does as well. And they see 70 to 110 people a day. Now, they do not receive homeless funding. So they rely...
Vinnie's funded. They're
Vinnie's funded, and they're reliant on the kindness of strangers, basically. So they get donations from people, but it's very inconsistent. But that's where most of our homeless people are directed to, and that's where they get those assistance when they can with filling in forms. But they've got, I think, 4 staff, but they've now managed to get the health service to attend there on a rotational basis every Tuesday, and they're picking up things like, there was a woman with a chronic skin condition. They had taken her repeatedly to the hospital and they'd gone, mental health, it's, you know, she's dysregulated, we can't deal with her. But what it ended up being, the doctor who was attending the homeless service went, actually, I think there is a chronic condition here, and they resolved that and have made this woman's life 100 times better. But because there is that stigma and discrimination, it's these services that we rely on to refer people to us.
So that's like a very practical outcome. But then I guess because we cover such large geographical areas as well, you know, there's only 3 of us in the team and only one homelessness solicitor. So, you know, we end up with service black holes where if the services in that area are not as engaged or well resourced, it's much more difficult for us to service that area from a legal perspective as well. So it's a constant, you know, tension trying to, you know, we've got this huge area that we cover, but it's difficult to really service every part of that region. And so, you know, I guess we would love for more community services to be funded to kind of work with us in that respect as well. We'll talk about a few case studies that sort of demonstrate some of these issues. This client of mine, she became homeless. She was in social housing. She was evicted for rent arrears. Part of the issue around that was she had 3 older children, all with really complex disabilities. They were on the wrong Centrelink payments. She couldn't get them sorted out. It was all, you know, there was just too much going on in her life. So she wasn't receiving what she was entitled to, but she was being charged a subsidised rent as though she was. Massive rent arrears, evicted. And so then she gets a social housing blacklisting. but she's homeless with her 3 kids, whose, disability, the impact on their disabilities significantly is exacerbated. There's child protection involvement, and she was coming to me to help with removal of the blacklisting. But the difficulty was that she was having to focus on temporary accommodation. Where are we going to be tonight? She was based in Grafton, but she was put in Woolgoolga, which is an hour away. And her NDIS support workers for her daughter, she couldn't access them. So then she was doing the caring for her daughter. And so she's unable to engage with me, and there was no services that could help her with that. And so there's just been this pattern. She really is trying desperately to do, to take the practical steps that we need to help her remove this classification, but it's just this continual disengagement because of the immediate need that's in front of her. And yeah, so it's really been really difficult to get to a legal outcome. And I think that that's exacerbated by being in a regional area, so we're using more of our resources to try to get to an outcome for this individual, because there's less support for her. But we'll keep trying. We'll just keep being persistent, that's all we can do.
I'm conscious of time. So I put in the second case study just because it's a contrast to, it's about early intervention, basically. So I had a client who was in a very similar situation to this client, but because I was called earlier, we've got a health justice partnership with the local hospital, and they got me on board quickly for a client, and we were able to negotiate. We were able to talk about not getting a listing. I was able to get someone to go and get some of the goods back. They were being moved into, they were in the mental health rehabilitation unit and being moved into a supported accommodation. So the fact that we were able to negotiate a relinquishment, stark contrast to this client, which was heartbreaking to turn up at the end of all of this. Really, I was just information gathering. They lost photos of elders, family members that they will never be able to retrieve. So the importance of the relationships is that early intervention. If you can get the legal services in earlier, then that will help.
The only other pointer that I was wanting to make was around the community housing providers as well. A big transfer of stock from Homes New South Wales, and it's obviously really problematic in the cities, but it's even more problematic in the regions where you literally have one community housing provider for an entire area. And as Kira was saying, policies are not the same across the board, and you're pretty much always going to be disadvantaged if you're in a community housing provider to Homes New South Wales. And so this is what we're sort of referring to when we talk about the postcode lottery. There's just no options to move. So, obviously even in Sydney, people are, very embedded in their communities, and it's not a simple task to talk about transfer, but they can do that. Whereas in our areas, they're really restricted, particularly with the lack of infrastructure and transport. A lot of people are restricted to being in a very small location if they don't have a car, or so that transfer of stock has had an even bigger impact, and we see it in different areas. Like, I had 3 clients who were all in custody, and I was negotiating on extensions so that they wouldn't lose for their absence from their properties, and I had one who was a homes tenant who got a 12-month absence. I had one who was one CHP and another one who was another CHP in different parts of the region, and they all had different outcomes because the CHPs only had 3-month policies. But then one of those CHPs applied that policy in a more discretionary way than the other one. So very little transparency and consistency across the board there. So yeah, it was just, I'm just sitting there going, literal postcode lottery. So yeah.
Thank you, Mel and Kylie.
Thank you.
Thank you, Mel and Kylie. I'd just like to invite Eloise into the discussion now. Eloise, can you hear us okay?
I can, thanks.
Great. So if you've got questions for Eloise, please use the microphones. Look, the first question I have actually is for Eloise. Just to talk about some of the knock-on effects of homelessness, housing scarcity, and overcrowding in RRR areas. We've just heard from our Coffs Harbour speakers on that. I'm just wondering, from a tenants union perspective, what are some of the knock-on effects of these issues, particularly with respect to legal and non-legal service provision?
Sure. I think one of the main issues that the local tenants advice services in RRR communities see is that really that scarcity of housing, and in particular supply of safe and affordable housing, means that many people are actually living in substandard homes, which can result in creating physical and mental health issues for people, or even exacerbating them further. So I think that's a key point to mention there. Some of the other knock-on effects that tenant services see is that people really have to put on the back burn their health needs. So they might have to forego surgeries that are needed or cancel medical appointments because they're dealing with tenuous housing situations. And that also relates to people who have to drop out or delay tertiary study for that same reason, because they have to prioritise their shelter, or because of that scarcity of housing, they're having to move a lot further away from their medical supports or tertiary institutions. So they have to stop accessing those. People previously have mentioned issues with temporary accommodation, and I think it's important to also highlight is that obviously there is limited temporary accommodation options, but also because a lot of these communities are high tourist demand places, that often means that in periods of peak holiday times, those people in temporary accommodation are often being displaced from that accommodation, so that instead it can cater for tourists and holiday makers. So that's a real issue of concern in those areas as well. I think previously already mentioned the high demand and pressure. That's definitely felt by the tenancy advice services, and we know that the specialist homeless services and emergency relief providers are all feeling that pressure and demand with the increase of people that need assistance, and that obviously places bigger impacts on staff working in those services as well.
Thank you. I might move on to the next question for Thomas and Kira to consider. How can RRR CLCs advocate for better policy responses to housing insecurity and homelessness in their local area? And what's your advice to RRR CLCs wanting to keep local housing issues on the agenda and to track progress over time?
Sure, I'm happy to start. I think the first thing to do is really monitor the implementation of tenancy legislation reform. So in New South Wales, since 19th of May, we have new provisions around reasonable grounds for landlords to terminate tenancy. Unfortunately, New South Wales government has already decided to undermine their own legislation just 5 weeks into the new provisions, and that's by lowering the evidence requirements for the use of significant repairs or renovations as a ground to terminate tenancy. It will now be just a written statement from the landlord. At Shelter New South Wales, we don't believe that the 4 weeks exclusion period on reletting the property is appropriate. It used to be longer than that. We don't know why the New South Wales government has done that. It has been done behind closed door. The tenants union, our colleagues at the Peak Body are coordinating an action against that. So that'll be the very first one. And second, on that same point, before I hand over to Kira, I think it's really important to make sure that these reforms are not just rights on paper and rights at law, but rights in practice. And that's particularly important for the people in the communities that we service. You know, many of us in the room are probably renting their home. If my landlord is doing something dodgy, I'll go to NCAT. I'll actually go off my way to make their life very difficult. But it's not always the case for people who are quite used to face disadvantage and being disempowered, and they just receive even a little bit of a threat from the landlord to terminate the tenancy, and they will vacate of their own volition. So it's really important that legal support services monitor the new provisions and campaign with peak bodies and community services to ensure that people have access to tenants advice and advocacy services, and that those rights are the same rights for everyone. And obviously to continue advocating for further law reform on the amount of rent increases. Better regulation of rent increases is really important, because if you reform tenancy legislation around evictions, but landlords can still give really excessive rent increases, then you still have de facto evictions, because if you can't afford the new rent, you are still being evicted from your home. So I really think we need to continue talking about better regulation of rent increases, including the quantum and not just the frequency, which we already regulate. Over to you, Kira.
So I mean, I feel like when I come to these things and you hear about the stories and the similarities between all of our experiences, really, I mean, I know that there's differences because people are in different regions, but the story that Melanie just told and you know, it's so similar to the stories that we hear. So I really feel like opening up and having an opportunity for us to talk more to each other is really beneficial, particularly for us as the Homeless Persons Legal Service. We have some resources to bring together, you know, to advocate and to put together information and papers. And I know that a lot of the centres are really stretched in terms of, you know, you don't have a policy officer who's dedicated to just doing this work. So I feel like, yeah, working more together and being able to put together a whole series of case studies about what's happening. The CHP issue, the issue of early intervention, and the fact that people don't, I mean, Thomas is talking about people not understanding the new changes to the law, but people who are in social housing, they get a terminate, you know, and they just leave, like they're not seeking legal support. They're not accessing it. We're just getting so many people coming to us and it's too late to do anything. I can't, yeah. So I don't know, you know, we're stronger together, I suppose, is what my, yeah.
And we heard a little bit from each of the speakers about enforcement of local bylaws. Do you have any advice on getting local councils on side?
I think our housing partnership has the local council attend, and so there are representatives from the social housing providers, us, also homelessness services, youth services. So the nature of the discussions are pretty frank at times, which they deal with quite well. So it allows concerns to be raised, and I do think, you know, I do think those interagency groups are essential. But that is again about relationship building. So that is a good way. If you can build those relationships, a lot of councils have housing officers. We lost ours in costs, but building those relationships is really important.
And on the question of councils, I think it depends on what part of the housing system topic you're talking about. If you're thinking about affordable housing delivery, it's important to note that councils can now levy affordable housing contributions. I know that's not necessarily the remit of CLCs, sorry, but it's certainly something that we support, that as development occurs, as rezoning occurs of land and upzoning, so allowing further height and higher floor space ratios, we actually deliver affordable housing in the process. Perhaps more in a more relevant way to CLC's Human Rights Act, I think could go some way, in particular when it comes to homelessness in public places. I know that there was a case recently in Queensland where the Human Rights Act was used by lawyers to fight back against councils, Moreton Bay Council specifically evicting people from where they were living. So that could be something that's interesting to look at for human rights lawyers and lawyers more broadly.
We have a question from the floor.
Sorry. So I'm from Walgett. I'm speaking as a part of like a community member from back home. So housing instability is big everywhere, especially in rural towns. We have families living upon families, and it's creating a lot of issues, not just health issues. It's creating youth crimes. It's creating mental issues. It's creating, you know, like Walgett is maybe 2 hours away from other services, the closest one. We fly in, fly out. So they don't know our history. They don't know how our people and the way we live. What we need out there is more houses. There's 7 houses out there boarded up, and they refuse to put anyone in them. I have a cousin who's living in the backyard in a tent while their father lives a single man in a 3-bedroom. How is that fair? These are some of the things that we're dealing with out there.
Thank you.
Yeah, just want to acknowledge that it's even, in a lot of those, we understand in a lot of those remote communities, it's even more difficult. Yeah.
Our men, they live on the street. They don't have the same support as a woman with family. You know what I mean? It's very hard. Even just like 1-bedroom flats for them would be good. But in saying like what I was meant to say was my cousin, she's got 3 kids. Her and her partner live in the back of his grandmother's house, you know, in a tent, while her father lives in a 3-bedroom. And that's pretty, sorry for swearing, but fucked up.
We are seeing a lot of people near boarded up houses where they've been removed from, where they're actually camping out the back. So you've got to,
She was in with Links to Homes, so she linked with Mission Australia, went into Links to Homes, was in the motel. Couldn't afford to stay because her son is 14. He wasn't allowed to stay in the refuge that they just built, in the woman's refuge, which is bullshit. So her son had to live with her father who kicked him out. So what is she going to do? She's going to move out of that situation to protect her child.
And there's definitely a lack of recognition in terms of the financial cost of homelessness. So, definitely support the idea that the contribution for temporary accommodation should not be 25%. I guess the rationale is, well, that's what you pay for in social housing, but you're not also paying for storage, for travel to, 2 hours somewhere, buying food because you can't pay for it. Exactly. All of these things, it's expensive to be homeless. It's not, No, absolutely. Yeah.
And we agree that we need so much more social housing. I can't even begin to start how much more social housing we need to go back to 10% of the total stock, which is not even that much when you compare to other OECD countries. What we are advocating for as part of the shelter network is to multiply by 4 the investment in the housing fund from the Commonwealth, so we can use $2 billion per year from the Commonwealth, and from that to be matched from the states as well. And when people say we don't have enough money, we have plenty of ideas as to where to find the money as well. And that's to start by reforming the tax breaks that cost about $15 billion a year to the Commonwealth in foregone tax revenue, so people can speculate on land, on stolen land even more so.
And I was going to ask that from a solutions-based point of view, how do you, what do we do from here? And just context my question, it's at the back of what you mentioned. I'm from the Tweed area. Tweed Byron has got one, like the highest homeless rate in the state, I believe, outside of Metro maybe, or the highest, off the back of the floods and the lack of stock from buybacks and other properties just becoming unlivable. All of the issues you've spoken about are rife in our community. And then you have the government build a complex in Tweed, and they're putting, same point you've made, they're putting a couple in a 2-bedroom home, and they've got people and not allowing people with animals or children in there because they want to create a feel for the place to start with before they allow other people in. So you've got a father and his daughter trying to be restored to his care who can't get housing in there and have to go elsewhere. All of these issues that compound for these people. You've got people who have a right to stay in the property because they've been there for years and years and years, but they might be one person now in a 3-bedroom home, and you've got families trying to cram into cars to live. How do we advocate for homes to rethink people on these long-term leases and shuffle people around? I know it's not necessarily what you want to do, but when you've got someone who could be in a 1-bedroom house and you can then house a family in the home they're living in, how do you advocate for that as well as replenishing or getting new stock?
Yeah, I think that what that speaks to is a real inconsistency in the application of policy, because they absolutely have policies to allow for that. If somebody is in a property where they're under occupied, they've got policies where they can transfer. And, you know, that process needs to be done properly and fairly, and that person needs to be transferred to another property that really meets their needs. And unfortunately, they don't apply those policies consistently or well across the board. And particularly when it comes to community housing providers, you know, as opposed to government, there is a lot less transparency. There's no ombudsman that you can complain to. The community housing registrar has really limited powers in terms of what it can do when, and it doesn't really have any power to, you know, force housing providers to follow their own policies. And, you know, when the transfer of stock occurred, there was not much written into the contracts in terms of what the policies needed to look like and how consistent they needed to be with Homes New South Wales. So, I mean, Legal Aid has a law reform project at the moment on this very topic, trying to advocate with government on, you know, it almost feels like it's a bit too late because it's difficult to claw back, but still there's definitely work that can be done to improve consistency and transparency across the community housing sector. Yeah.
Implementing that.
True.
They're unsafe
Yeah.
in their social housing. They've got crime going on around them all the time. So they're stuck inside their homes and they can't leave, or they're having home invasions and being hospitalized time and time again, and they can't even get a transfer. So homes aren't setting the bar.
Yeah, true. Yeah.
I mean, we could be here for days. Housing is such a long, complex, broad topic, but just two quick thoughts to answer to you and to answer to your question. I think it's important when we talk about under occupancy to keep in mind the scale of the need versus the amount of properties that might be freed by transferring people across. There was in a Hurry report a couple of years ago, it was Australia, not just New South Wales, but it said we needed about 800,000 new social housing homes. That is not on the same scale as the number of properties where people have an extra bedroom and where they could be moved to somewhere, and then a family could take their social housing homes while continuing to maintain their social networks, the services that they access, any other needs that they may have to live in the area. I mean, I'm sure the under occupancy policy could be better applied, but we're not exactly talking about the same scale, and that's why we focus on social housing delivery. And just a quick point on community housing providers, it's not ideal. I'd just like to remember, I guess, the other side of the social housing management system, which is Homes New South Wales, are very far from being the best in the world.
Yes.
As well.
Yeah. There's no good whole topics of their own, aren't they?
Yeah, absolutely. Yeah.
Over here.
Yeah, I've just, yeah, I just have a kind of question that might be a practical thing. So I'm from the peak body. I do, and I convene the Law Reform Network with Neve and a couple of other folks. And we are actually hoping to get Natalie from the Legal Aid thing in to have you on at some point about, oh no, prisoners' rights. We want to get Natalie to come and talk about the housing stuff. Anyway, come to that meeting. But we run quarterlies, and there is a significant, there is an odd gap to me as a housing researcher that we don't have a network focused on housing. And I know that there are already many networks and people don't have time to go to them all, but I'm wondering if there would be interest in the sector to have either a housing working group of the Law Reform Network or have our own housing network. So I kind of want to plant that seed that I know it's very relevant to my interests as a housing person, but I think it's relevant to all our.
I'm into it.
I feel like we're all
we're
doing things in isolation as well. Like,
Yeah.
I mean, also NLAP is also kind of interested in homelessness, and so there's a network that's been developed with that. But I think it's absolutely as I said before, we're stronger together, and we have so many similar examples and stories and problems with a specific CHP that if we all came together and went, oh, did you get have you had the, and so then we have a concentrated campaign around that, around making changes, because I think we need to be stronger and smarter than, and as far as homes goes, like I don't think that they're perfect. I don't think, but I think we have a good opportunity at the moment with Rebecca Pinkstone at the helm and Rose Jackson. You know, like I think that there's a good opportunity right now to really push homes in again.
And I will just mention a good news story from a legal aid perspective that I think Kira knows about, and you're probably referring to yourself, is the Homewood Sisters project, which was a collaborative project led by legal aid with Homes New South Wales and corrections. And it was a focus on Aboriginal women in custody who have you know, they're significantly overrepresented in terms of leaving custody into homelessness, which obviously then also leads into issues around removal of children and ongoing issues like that. And for years and years, we've been talking about the blacklisting, social housing blacklisting policy that has a really disproportionate effect on Aboriginal women in custody. And we were able to get some traction where we did a 3-month pilot where essentially it was a real housing first approach where they removed a lot of barriers, was focusing on just doing whatever they could internally to remove barriers to homelessness. So whether that was removing a blacklisting, assisting with the reactivation of an application, wiping the debt, in a way that was far less difficult than having to do an internal appeal and bring all this evidence forward. Essentially, the prisons allowed legal aid in. They did a lot of, you know, focus groups and things in prison with Aboriginal women. And I'll give you the stats, which is really small, but I'll find it here. Homewood Sisters reached 2 out of 3 Aboriginal women in custody across 10 New South Wales correctional centres, receiving 247 referrals with 105 clients to date getting positive outcomes. And there's now an agreement to continue this going forward, not just for legal aid clients, for any Aboriginal women in custody. So it's, again, I think that speaks to the current climate of who's in the room and being able to leverage, you know, good timing and yeah.
Now we have 5 minutes to go. Can I just say one last question here, and then we're going to need to wrap it up.
So, tenants union, if anyone wants to start an actual union, I'll pay you fees, because I feel like renters are making up the majority of people with the minority of power. And I just wanted to quickly touch on discrimination as an issue. Is this being recorded?
Yes.
Won't say it. I'm a single mum, recently, change in circumstances, bumpy journey, read in between the lines if you like. And I applied for 22 private rentals before I got one, and I only got one when I invented a husband to go on the application. Anyway, and I went to inspections where single mums weren't allowed to inspect properties. They were stopped at the door when they had kids with them, where people who presented as queer weren't allowed to inspect homes, where people who were Aboriginal weren't allowed to inspect homes. And nobody wants to bring a discrimination complaint because you have to put your name on the paper and there's only 5 real estate agents in town. But in an employment context, the union can put their name down as the person running the matter to protect workers' rights. What scope do you think there is to change the structures that we use for advocacy to address that power imbalance in the context of not only private rentals, but also Homes New South Wales? Nobody wants to kick up a stink with the power imbalance in the way that it is.
Eloise, did you want to kick off on this one?
Yeah, I think in terms of discrimination, we see that across the state, it's a massive issue, and it's something that we've advocated for to the government, that they need to improve the whole application process for tenants when they're applying for properties in New South Wales, because as you pointed out, there's huge discrimination. There is a bill that's been introduced into Parliament which goes some way to try and standardise that application process for tenants, to try and remove some of that discriminatory behaviour that we see, but it's definitely not going far enough as far as we're concerned. And we're also feeding into the review of the anti-discrimination laws in New South Wales, which is happening at the moment, to provide extra protection for tenants, because we do see that is a massive issue.
might be being shy, but the tenants union is an actual union. You can join and pay your dues. I'm a member myself. Yes.
Not a union in the
You guys
traditional
make
sense,
that
so I think
information
gets
available
confusing.
for everyone? Because
Sorry?
that's probably, can you guys make that tenancy union thing available for everyone so we can share the information? And
Yeah,
just
definitely.
adding on to the discrimination thing, like living in rural, remote areas, it's not always like, oh, you know, that person's queer, that person's Aboriginal, that person's a single parent. Because there's so little services in these areas, if someone working in that service does not like you, well, then there's no point even trying.
Yeah, absolutely. Yeah. And ideally, the whole competition process that relates around private rental, it needs a fundamental change in order to remove that. So where it is that competitive process and agents and landlords, they get to choose and they can be discriminatory and decide they don't particularly like someone. So it does need a whole reworking of how that actual application process works.
That is all we've got time for today, but just look, Mel has already mentioned Homeless Sisters. Just quickly, other members of the panel, can you cite a small creative project in Australia or overseas that you think has the potential to make a difference?
I'll go first and I'll be short and I'll reject the premise of the question. We do that at every forum. If there was small, cheap, creative ideas to achieve housing justice, we would have done it already. Would like to see massive at-scale investment in social housing and tax reform.
Excellent.
Now I've got to go on the back of that. I mean,
We should always let Thomas speak last.
Yeah, last. I mean, there's lots of, you know, providing protected refuges for women exiting prison, which is what the Women and Girls Emergency Centre has done recently. I mean, it's like 5 houses, so it's like not very much, but Habilis in Sydney, I don't know if you've heard of this. This is run by a psychiatrist in Sydney who, for people who are experiencing chronic homelessness, so where their mental health and often drug dependence is just meaning that they're just on a cycle of just staying in homelessness. And he will house them for a period, you know, for kind of getting them into stable housing, trying to get, you know, correcting meds, correcting, you know, all of that stuff. Those kind of programs, I mean, very, very small. Sydney Zero, which was a collaborative, like an interagency, but hadn't like the frontline services, SHSs, homeless health had not come together in a room before Sydney Zero. And so now they're a stronger voice together. Yeah, the Together Home program, which is no longer, actually had some really great outcomes for some, again, chronically homeless people that came out of COVID. It was housing people for a period of 2 years with support. It was a housing first approach and it's no longer.
We've already done ours.
All right. Everyone. Thank you so much to our speakers today. And I think there is an appetite to get a working group together with a focus on law reform and policy. I really appreciate you bringing those perspectives to the discussion today. And on behalf of everyone here, thank you.